My name is Dr. Richard Lubega, Executive Director, Busesa Community Development Organization, and the proprietor for Busesa Medical Center 3, located in Busesa town, Malaria sub-county, Kibaale District. Today, the 17th of May 2026, we have managed to launch a malaria campaign program, test, treat, and distribute a mosquito net. We have launched this campaign in this area of Itomero, Malaria sub-county, Kibaale District, after our study for the data at the district, and we found out that Itomero in Malaria sub-county is a hotspot among the areas that are affected by malaria caused by Anopheles mosquito. Now, we have today received an overwhelming number where we have managed to work on over 500 people around who have come to be tested, and to those who have been found with malaria, they have received anti-malarials, Coatem, and they have also gotten mosquito nets. And we have also included the eligibility to those who are supposed to receive mosquito nets. We extended it to pregnant mothers and elderly people who are above 60 years. Whether we found them with malaria or not, they are eligible to getting a mosquito net. Why? Because we see these are vulnerable groups, the groups that are at risk of suffering from malaria with its complications. Now, this exercise is supported by joint medical stores who supplies us with the mosquito nets, the anti-malarials, we can call them anti-malarial commodities, with support from the district local government for Kibaale, who have supported us and authorized us to move across the district of Kibaale, taking through this program of malaria control. Why did we decide to have this program of community malaria control? We came to find out that Kibaale is among the districts which are still having hard-to-reach areas, and one of them is Itomero, whereby we find these people cannot easily receive services of controlling malaria due to the distance that is between Itomero and the nearby health facilities, government facilities. So we identify the needs and the qualification of areas where we can go next, basing on the malaria burden within that locality. So the program is running all around Kibaale District, and from here we are going to have other areas within Kibaale, basing on the scrutiny of data at Kibaale headquarters, where we shall find another area that is next to Itomero with the highest burden, with high burden of malaria cases. So today we have seen it, this program, a successful one, to test for malaria, get treated, and get distributed with the mosquito nets, and over 500 people have been screened of malaria. Now, when you look at the principles of public health, I'm a public health specialist, and I have a master's degree in public health. For us, we don't target individuals, we target communities. So we look at the health of the many. We don't look at the health of one individual. So when you protect the health of the many people, there you are targeting reducing the burden of the disease or condition. So today we have used that principle of targeting many people basing on the well-known scrutiny of data at the district of Kibaale to identify areas that need attention in the malaria control program. Today, we are also doing health education. We are not only testing and treating those who are already having malaria, but also we are giving health education to these people on how best they can prevent themselves from getting or being infected with malaria by telling them on how they can slash bush around their homes, reducing stagnant bottles or completely removing them from their homes, then also trying to sleep under insecticide-treated mosquito nets. And we have also showed them how best they can use the mosquito nets because we find that there are some people who take mosquito nets but they don't know how to utilize or use these mosquito nets. So today we have successfully managed to distribute over 100 mosquito treated nets, and people who are eligible to this, the pregnant mothers and those who were tested malaria positive, those elderly group that were above 60 years, they were the eligible groups that we managed to distribute over 100 mosquito nets. And among these, we have managed to test positive clients, over 60 clients. And that is a big number if you can assess it and try to classify it in the burdens of diseases within this area of Nyamarwa. People who tested malaria positive, they have managed to get anti-malarials, that is coatem, and a mosquito net. So basing on this impact for this program that it has primarily caused within this area, we appeal to different stakeholders in the malaria control programs like the joint medical stores, Kibaale District local government, Ministry of Health, to embrace this program of community-based malaria testing, treating, and mosquito net distribution. We also request those stakeholders to support us with malaria prevention and control commodities, where we have the mosquito nets, the anti-malarials like the coatem. We also request for gloves, the malaria test strips like the RDT, and also support in human resource like in transporting the commodities, because we have farthest areas where we are going to be moving, and we have seen already this program yielding good impact to the community, and we are seeing the community really appreciating and coming to utilize this kind of service. Today, the program has really defined what we call hard to reach areas, and we really have gone to the hard to reach area, and we are seeing people getting tested and getting services on the control of malaria within their families. Because now we would prioritize whoever comes for this exercise, whoever has been tested, be it negative, because we see everybody here seeing malaria being an endemic disease. They are all at risk of contracting malaria. So if we are given enough commodities, we will be able to distribute malaria mosquito treated nets to everyone that has managed to go into the line and screen. But because we have limited mosquito nets, that's why we have prioritized giving to only those who have tested positive, the elderly from 60 years and above, those who are pregnant mothers. So, but the idea would be everybody to get a mosquito net. Also, we are looking at this program, connecting it to the presidential initiative of socio-economic transformation. Because if we have a community that is sickly, that is not healthy, we are going to find kind of retardation in the area of socio-economic transformation. We all very well know that malaria is a disease that cannot allow someone to do well, to do his enterprise, to work well into his enterprises. Even children, we have seen this affect children's performance in schools. We also see one of the complications of mothers getting abortion, losing their pregnancies because of malaria infection. So if this program is supported, we think this will also increase on the presidential directives, on the presidential program for socio-economic transformation.